You're a picky eater, right, Maria? I just want to make that clear, right?
Were you? No.
No. Okay, so let's talk about the COVID vaccine. We were just talking about it a second ago. Big change for the COVID vaccine, and it has been a topic of conversation lately. You recognize Dr. Todd Eller, Chief of Infectious Diseases at South Shore Health. So here's where we stand right now. The CDC now says it will no longer recommend routine shots for healthy children and healthy pregnant women. So is this the right call?
All right, so sometimes the message is as important as the messenger.
Got it.
So I think the message, what we're hearing, is that the COVID vaccine is going to still be indicated and recommended for the vulnerable groups. But for the healthy groups, it's no longer being indicated by the FDA. We're still waiting to see what the CDC says. They're going to be meeting formally in June, okay? But the bottom line is this. I also think the FDA is saying, we want this to be studied in the healthy patients to see if it works. Why? Because we're no longer, in the beginning of the pandemic. So it's 5 years later. We've all been either vaccinated or infected or both.
Right.
So the question is the vaccine necessarily in healthy people? And I think that is a question that really could be studied. By the way, one more thing.
Yeah, go.
Remember, less than 25% of Americans are actually getting boosted.
Got it.
So sort of the treadmill test is already being done.
Okay, so just to be clear though, if pregnant women won't be able to get the COVID shot anymore, even if they still want it, or will they be able to get it if they would like it?
Right, so I was a little surprised to hear the announcement included pregnant women. Why? Because the FDA listed pregnant women as one of the high-risk groups.
Right. Okay,
but with that said, I think whether they'll be able to get it is still a question, right? What is the CDC going to say? Maybe they'll carve out one high-risk group as pregnancy can still get it, so we have to see.
We're showing some kids in this video here. It's the same for if the parent wants it for the child, is it okay? Is it a go, or what do you think?
Right, so again, we have to see what the FDA formally says about pregnant women. We have to wait to see what the CDC recommends, right?
Yeah.
The FDA gives an indication.
Right.
That's linked to its label.
Right.
Are the manufacturers going to remove that indication from the label?
Got it.
Is the CDC going to recommend it? Will insurers still cover it?
Right.
I think there's a lot we don't know.
Yeah.
Okay?
Yeah.
But a reminder, with pregnant women, you're not just dealing with one patient, you're dealing with two.
Exactly. So we're not done talking about it. We're going to continue to talk about it. But I also want to ask you about a warning from this past weekend. State public health officials say that anyone who ate at the Red Inn on Commercial Street in Provincetown between April 30th and May 15th, there's roughly a 2-week span there, was exposed to hepatitis A. A, what can you tell us about the infection? And B, if you think you are infected, how concerning is it?
We hear a lot about foodborne bacterial illnesses like salmonella. Hepatitis A is a viral foodborne illness, okay? And in this case, it was a food handler at that restaurant that was infected. So the good news is people who are exposed between April 30th and May 15th, if they've never been vaccinated, you can get a vaccine and that can protect you. This causes viral hepatitis, is inflammation of the liver, okay? And it is preventable with vaccination.